Question: Chemistry of digitoxin. ANS biological source: dried leaves of Digitalis purpurea, foxglove leaves, family Scrophulariaceae, dried at a temperature below 60°C. Digitoxin is a cardiac glycoside. It has a complex chemical structure. The molecular formula for digitoxin is C41H64013. Its chemical structure consists of a steroid nucleus, a lactone ring and several hydroxyl groups. Digitoxin affects the heart by inhibiting the NAK pump, which can lead to increased contractility of the heart muscle. Mechanism of digitoxin. 1. Inhibition of NAK pump. The NAK pump is an integral membrane protein found in the cell membrane of heart muscle cells, cardiomyocytes. Digitoxin binds to a specific site on the NAK pump and inhibits its activity. This binding is reversible. 2. Increase in intracellular sodium. Inhibition of the NAK pump by digitoxin leads to an accumulation of Na ions inside the cardiomyocytes because they can't be actively pumped out. 3. Indirect effect on calcium. Elevated intracellular sodium reduces the activity of the Na-Ca exchanger, which normally of the parts calcium ions out of the cell in exchange for sodium. With less Na-Ca exchanger activity due to the elevated Na, more Ca ions remain within the cardiomyocyte. 4. Enhanced myocardial contraction. Increased intracellular Ca concentration lead to stronger and more prolonged contractions of the heart muscle. The stronger contraction of the heart results in increased cardiac output and improved pumping of blood. Clinical pharmacological action of digitoxin. 1. Positive inotropic action. Digitoxin increase the force of myocardial contractions. By effectively enhancing the contractility of the heart muscle, digitoxin helps improve the heart's pumping action, leading to increased cardiac output and better circulation. 2. Negative chronotropic action. Digitoxin decreases the heart rate. It does this by slowing down the firing of the sinoarterial SA node, which is responsible for initiating the heart's electrical impulses. This action can be helpful in certain arrhythmias. 3. Improved hemodynamics. Hemodynamics refers to the study of blood flow and the forces involved in circulation. Digitoxin helps improves hemodynamics by increasing stroke volume and cardiac output. This can be especially important in cases of CHF. 4. Reduction of cardiac preload. Digitoxin can reduce the preload on the heart by promoting diuresis, increased urine production. This helps reduce fluid retention and congestion in patients with heart failure. 5. Electrophysiological effects. Digitoxin may be direct and indirect effects on cardiac electrophysiology, influencing action potentials and ion transport in cardiac cells. 6. Longer diastolic filling time. By slowing the heart rate, digitoxin prolongs diastolic filling time, allowing the ventricles to fill with more blood. This can enhance cardiac output. Therapeutic uses of digitoxin. 1. CHF. Digitoxin has been used to treat CHF. It increases the strength of cardiac contraction, which can improve the heart's pumping action and help alleviate symptoms such as fluid retention, shortness of breath and fatigue. 2. Atrial fibrillation. In case of atrial fibrillation and irregular and often rapid heart rhythm, digitoxin may be used to slow the heart rate and promote a more regular rhythm. It helps control heart rate. 3. Supraventricular tachycardias. Digitoxin can be used to slow down the heart rate in certain supraventricular tachycardias, which are rapid heart rhythm originating above the ventricles. 4. Cryogenic shock. Digitoxin may be used to improve cardiac output and blood circulation. 5. Enhanced exercise tolerance. Digitoxin can improve exercise tolerance by increasing the heart's pumping capacity.